Priyanka, I appreciate if you can able to elaborate on this question. Why FDA asks for justification, and if so, when required to be supported with supporting data?
Sure. Thank you, Usha, for that question, because I think um, it's fantastic to take this opportunity to clarify where as reviewers or assessors, sometimes we have questions. So I will use a couple of examples from perhaps the IVRT sessions yesterday afternoon. So we talked about the vertical diffusion cells, and this morning even we heard that typically vertical diffusion cells are preferred for IVRT studies, although both the vertical diffusion cells as well as the emergent cells are actually listed within 1724. So like as an example, if you are selecting to use, or if an applicant is selecting to use a vertical diffusion cell that is pretty standard, one of the cells maybe that was demonstrated this morning, then I think it may be sufficient to note in the submission that you selected a cell for the recommendations within 1724, and also because you have access as well as you have expertise using that specific cell. On the other hand, another example that was discussed yesterday is related to the dose that is applied, say, for example, in an IVRT study. We typically say that we need a pseudo infinite dose. So say, for example, during your method development, you identified that 100 milligram dose is a quote unquote pseudo infinite dose in your case. It is not a very standard dose. It's typically on the lower side. So in those situations, we would encourage you to provide us with the data that you generated during your method development to illustrate how you identified the 100 milligram dose as your pseudo infinite dose, so that the assessor is able to review the data and understand and gain confidence that whatever dose is being proposed is truly a pseudo infinite dose. And I use the example of 100 milligram. It is very, very atypical that we see such low doses in the IVRT study, but I thought it was a good example and connecting to some of the discussions that we had. So those would be two situations where an explanation, just writing out why you selected something based on experience, based on lab expertise, versus situations where we actually would like to see some justification supported by data. Anyone else from the panel, would you like to add?
Just to add one more example, yesterday we were talking about some of the chemical agent that should be either for, like, there are certain like alcohol, like that is definitely no for the IVPT. Similarly, some of the chemical agent is also, like, where if you go directly to that receptor solution, we may ask for some additional information that, have you tried some other chemical agent like hydroalcoholic receptor solution to start with, and if you are having some struggle to conduct either the IVRT or IVRT study. And so in those situations, yes, we do ask, but if you have a very thorough development where you go by the step by step, there is no need for any additional data. I mean, it really case by case basis.